Good morning, everyone. It is March 8th. Welcome to the Morning Medical Update. Thank you so much for joining us here on Facebook, YouTube, and now on Twitter. Recent CDC data reports children who have had COVID have a higher chance of developing diabetes. This morning, Dr. David Robbins, director of the KU Diabetes Institute, and Holly Kramer, a pediatric nurse practitioner, they will both be with us today to talk about this growing concern, the latest therapies, and ways current diabetics can improve their lives. In medical headlines this morning, your child's risk of developing allergies and asthma could increase if they go to daycare. The American Society for Microbiology found many daycares have common molds and yeast that can cause breathing problems. Researchers say the number of kids in those areas change the indoor temperature and humidity, leading to more yeast and mold. And they find these reports to be quite alarming. Have you ever wondered why it is so tough to get back into exercising after taking a break? I know that feeling. Researchers at the University of Leeds say a protein that is important to blood flow is deactivated when we stop exercising regularly. Compromised blood flow can then make trying to get back into exercise more strenuous. Makes sense. And your GPS may get you to where you're going a little bit quicker, but it can also be putting your life in danger. Researchers at Texas A&M found that the route you are following may not be the safest. In one case, while one route cut the travel time down a bit, the risk of getting into a crash on that route was 20% higher because of bad roads, poor lighting, and animals darting out in the road. So if you haven't gotten your... Yep. Okay. Now we're moving on to our testing. Yep. You can click the QR code right there if you haven't gotten your 4 free tests from the federal government, or if your household needs more of them, don't worry, there is still quite a few available. President Biden making the announcement during last week's State of the Union address. Starting this week, you can sign up to get your 4 free tests or more tests right there. Again, use that QR code to click right there on your screen. All right, let's keep moving. We honor those who spent the past 2 years on the front lines during this pandemic. This past weekend, 24 nurses from right here at the University of Kansas Health System were recognized during the Jayhawks game over at Allen Fieldhouse. Yep. The nurses were honored on the court before the game, and a huge standing ovation for their hard work, as you can imagine, with all the dedication in helping all of us during the pandemic. So quite an honor, and great to see their faces out there. And also great to see that Jayhawks, they pulled off a win to capture a part of the Big 12 title. So that was a great night. Dr. Hawkinson, giving you a round of applause this morning. All right, get your questions sent into us on YouTube, Facebook, and the Medical News Network. You can find links to those right there on your screen. So let's get over to Dr. Hawkinson, Medical Director of Infection Prevention and Control, and Jayhawks fan and fan of all those folks that we saw out there. What an honor. That was kind of cool, right?
Yeah. You know, I sometimes people think I'm a little crazy. I always prefer that the Jayhawks win the conference championship first, and then let the chips where they may fall after that. But I think that's important. You know, they've had so many in a row at one point, and I think right now it's 16 out of 19 seasons. So get that conference championship, and then everything else will fall into place. But and right now it does seem like everything is falling into place with our cases as well. That is a good thing. We have 20 active infections right now, 2 in the ICU, 1 on the ventilator, still 63 in that recovery period, a total of 83. But overall, Jess, our active infections numbers continue to decline, which is a very good thing.
Can't ask for more than that. All right, some good news today. Doc Hawk, thanks. We'll get back to you here in just a moment with our community questions. I don't think we have reporters on the line today. So get your questions sent in to us today on YouTube, Facebook, and the Medical News Network. You can find links to those right there on your screen. We'll get those coming up here in just a few moments. Okay, so we know about long-haul symptoms in COVID with adults. We've heard about that from the beginning of this pandemic, from things like hair loss all the way to breathing problems. But there's a possibility that there's a new one for children, and that's diabetes. New data from the CDC finds that children infected with COVID were more likely to develop type 1 or type 2 diabetes 30 days or more after overcoming the virus. In fact, in one group, it was up to 166% more likely. Doctors say there are several reasons why this is happening, including genetics, the virus triggering an inflammation in the body, and a more sedentary lifestyle during the pandemic. That was kind of the case for a lot of us. Joining me now to talk more about this and help us kind of understand where we stand when it comes to kids and diabetes, Dr. David Robbins and pediatric nurse practitioner Holly Kramer. How are you both doing today?
Great,
Good,
thank you.
Good to see you both. This is a topic that, if it doesn't affect you, it probably affects somebody you know. So I'm happy to have you both here. And Dr. Robbins, I want to start with you. It's quite an alarming number as we talk about this. So what are we seeing here in the metro? Just kind of how has the pandemic affected how you're treating patients? What has the effect been?
Well, for sure, I think I'm commonly hearing from my patients that they've given up their exercise routine. Exercise and insulin sensitivity, how well you respond to the medications, are absolutely linked. And fortunately, I'm beginning to hear a little bit of light at the end of the tunnel that my patients are joining their gyms, they're going back and walking, and that can make such a huge difference in terms of their diabetic control.
So that's part of the regimen. Exercise is key for diabetics.
Absolutely, both in preventing diabetes and in treating it.
So I want to talk about some big leaps. You use that term, big leaps, when it comes to how we're treating people with diabetes and where we're headed. Let's talk about insulin pumps, for one.
So I think the diabetes is a somewhat unique disease in medicine, and it requires so much work and so much change in lifestyle from the patient. It's very difficult to maintain that regimen. So ultimately, what we want is a passive treatment. In other words, they get treated and boom, they can lead their normal lives and not worry about it. And we're moving in that direction, not completely there. We have now continuous glucose monitors that will measure the blood sugar fairly accurately every 5 minutes. And some of these will feed the data to a little insulin pump that then, what we call as a closed loop, will give you the amount of insulin you need to correct your blood sugar. So this has made a dramatic difference in improving the patient's blood sugars, and we're seeing it now with a reduction in heart disease, a reduction in eye problems, reduction in kidney disease. And then I think most exciting is that we have a couple of companies that are moving towards actually producing human islets. And there's been one example now of stem cells that have been reasonably easily converted into islet cells that are producing insulin. They've been put in one volunteer, and we've had long-term success in that volunteer getting them off insulin. So I think there's some exciting things coming, and it's my hope that our patients, particularly here at KU, will be at the front of the line when we have those treatments available and we can get them off insulin and off their medication.
I have a feeling you'll be the one pushing them right there to the front of
You
the line.
bet.
Because I want to talk more about the stem cells here in just a moment, but you said really the holy grail of diabetes is that the patient ultimately has to do nothing when it comes to taking care of and monitoring and stabilizing their diabetes.
Perhaps that's a little bit of an overstatement. I think we all have an obligation to stay healthy. I mean, that means keeping our weight down, exercising, eating well, which are all risk factors for diabetes. But once you get it, the treatment is so complicated for a lot of patients and so expensive. And there are just times that patients feel like they need a vacation from it. Yeah. And that adds up and increases the risk of complications down the line.
All right, so Holly, we're going to kind of ping pong back and forth because I want to jump in and talk about kids. What are we know? How does COVID-19 impact a child who already has chronic diabetes? What are we finding?
What we're seeing is a lot more isolation of these individuals who are already struggling kind of with their identity, and they also have kind of this chronic diagnosis already that they feel a little bit isolated from their normal peer group anyway. And so what we're seeing is kind of them feeling even more isolated, and the rates of depression and anxiety and things like that have gone up significantly too.
So I would just want to let everyone know, we just put a QR code up on the screen right now. It's going to link you to the University of Kansas Health System's Diabetes Center, so you can find out more information and jump on there and find out what you need to know. Okay, so I want to talk a little bit about research indicating that children are presenting later and with more severe illness upon being diagnosed, since being diagnosed before the pandemic versus after. Kind of help us understand that.
Yeah, so we're seeing about half of them actually coming in more seriousness with like more of a DKA, which is a serious condition, complication of diabetes, than about 28% pre-pandemic that we were seeing. And so it's, data is still kind of fluctuating. It's still kind of new, but it's kind of multifactorial from the lack of health care, the individuals that have been present for COVID, and kind of the focus on the COVID-19 patients versus someone who's newly diagnosed with diabetes has kind of been difficult. And then socioeconomic status too, and all of that has kind of really played a part in kind of seeing that fear of going towards the hospital during these times.
I would imagine, and that has been the case with so many different types of ailments during the pandemic. Just for people who don't know and maybe don't understand diabetes and what it is, just help us understand the difference between type 1, type 2. Who wants to jump in?
Well, I'm going to let you do type 1. I'll do type 2.
Okay, pick a type and then go for it.
So type 2 is the most common form in the United States. It typically affects older people, but we're seeing an epidemic of it in adolescents now because of obesity and inactivity. And it's almost always associated with overweight, to the point where the amount of insulin the body can make cannot drive the blood sugar into the cells, and you have a high glucose. And then all the complications that go downstream from that. These people have an increased risk of dying of heart disease, getting kidney failure, getting blindness. It's a very serious and costly disease for our society.
So the type 2 diabetes leads to other issues.
You bet.
That can lead to death. So in short, is it type 2 is something you develop over time?
Yep.
Type 1 is something that is hereditary, you're born with it? Help us understand.
It's like a predisposition to it, and then kind of some environmental factors can trigger it. It's called an autoimmune disease. So your own body will attack your pancreas or your islet cells and beta cells and make you just don't produce the insulin that you need to be able to control your blood sugars throughout the day, like someone who's got a functioning pancreas can do.
Difference between adult diabetes and child diabetes. What would be some of the big differences? And maybe as a parent, is there anything signs I should be looking for that they maybe have it? Are they tested for it at birth? How do you know?
Yeah, so if you have a family history of it, your risk of it developing it is significantly higher. Okay. But the signs of diabetes, we're looking for an increased thirst, increased urination, nausea, vomiting, some stomach pain, all of which can be common childhood elements, so it's really kind of confusing. But when you get them all together, a kiddo who's previously been dry at bedtime but now is not, or someone who you've seen taking multiple breaks during the day and going through glasses of water is something to kind of look out for. The difference between peds and adults from a diabetic standpoint is peds are constantly growing. They're constantly growing and developing and constantly changing their bodies, their hormones, and things like that, so that getting kind of that more fine-tuned control can be a little bit more difficult at times because they're also developing into their personalities and their behaviors and stuff, which ultimately has an impact as well.
So managing it is a bit different.
Yeah, I would say, but
how do you counsel though kids through that? I mean, being diagnosed with something like that, helping them understand what that means, helping parents understand what that's going to mean for them.
Yeah, it's a huge change. You just altered their life. You've just you've gone from a simpleton to kind of now every time we have to eat, every time we go someplace, things like that, we're constantly having to do things differently. And so it's just being there for them and having, that access to you as a provider to be able to help them through those transitional times.
What's it like managing adult diabetic patients?
Well, it usually sneaks up on you. More often than not, it's an insidious onset, and they come into their doctor or they come into the hospital for some other reason, and they're told, well, your blood sugar's high. You've probably had diabetes 3, 4, 5 years by that time. And I think it comes as a shock. There's often a lot of denial in it. And the early diagnosis of it gives us the opportunity to really turn things around. And hopefully if we can get the patient to lose weight, to exercise, get their blood sugars down, the prognosis is much, much better than if we let it go for many years. So in the beginning, there's some optimism, and we try to have the patient share that optimism. There's something they can do about it.
A couple of fact or fiction questions, if you don't mind, that popped up when we were putting these questions together. People with type 1 diabetes should not get tattoos. Is that true? Have you heard of this?
No.
No. So you can get tatted up. This is great. Okay, so good news
I
there.
have a lot of teenagers who actually get the medical alert system on their chest or something, so that if they do get in an accident or an emergency situation, that it's right there tattooed.
So a tattoo with a purpose.
Yeah.
Love that. Okay, so what about diabetes and gout, that connection?
Right. So type 2 diabetes has an association with gout. We don't know if the gout causes diabetes, but gout is associated with obesity. There's a genetic component to it, and there is a risk, actually a small risk, when you lose weight that you can have a gouty attack. So it's something we're aware of.
Okay.
Yeah.
Something that we talk a lot about, and we have throughout the last couple of years, is the mental health aspect of COVID and the pandemic. So, Holly, talk to us about the struggles with mental health in pediatric patients when they're dealing with diabetes. What have you noticed?
It kind of goes back to that isolating factors a little bit more. We're seeing, we're taking them out of their environment that they feel comfortable in, and they're going home, learning online, and having to manage their diabetes without the help of like a school nurse or resource officer there at school to kind of remind them, to give them the gentle push to kind of keep their blood sugars in check. But we're really seeing it kind of take a big toll, and not only for kids diagnosed with diabetes, but any chronic disease or any teenager in general. We're really seeing an uptick in the suicidal ideation and depression.
Dr. Robbins, we always have a crystal ball question here. So, with thoughts on finding a cure for diabetes, where are we at, or what does the future hold for patients?
Well, I'm very optimistic. I don't know if I'll see it in my lifetime, but I think the technology to cure type 1 diabetes is very far in development now. There's some commercialization, and we actually had the first drug approved by the FDA a few months ago that can reduce the symptoms and preserve some insulin producing ability in the pancreas in type 1 diabetes. Type 2 diabetes is commonly mistaken as an irreversible disease, and actually in most patients, when you get it early, there's a great deal of evidence that with weight loss or bariatric surgery and exercise, many people can enjoy decades of being diabetes-free, and in sometimes a lifetime of having it in the past. So that's a concept that we really have to drive into people and the practitioners that are taking care of them.
So with proper taking care of it, monitoring it properly, managing it, and changing diet and weight, you're saying that somebody who had diabetes could possibly
very often. For example,
have it.
Looking at bariatric surgery, which is one of the most extreme forms of treatment of diabetes, some studies where they get people early in the disease have shown a 90% remission. They're no longer diabetic as long as 10 years later. So they're really, the idea of going into despair and saying there's nothing I can do, I've got diabetes and I'm going to end up on insulin and have an amputation, is usually a misconception that I think is unfortunate.
Remission is not a word I hear with diabetes often, so that's something I've just learned today.
It's not something earlier in my career I think I would have said, but we're seeing it. We're learning how to do it.
What are your hopes for the future? What kind of conversations are you hoping to have with patients one day that aren't so grim as you see today?
Yeah, I'm hoping to provide those parents with that relief, to be able to sleep through the night without worrying about the blood sugars going up and down, or about their child going off to school for kindergarten for the first time and not worrying about their blood sugars there. So having kind of that more flexibility, the kind of running the disease and not letting the disease run them.
Makes sense. Okay, I have to ask you both this, and I've asked you this before, Dr. Robbins, about how you've handled your patients who, of course, are at high risk. Diabetic patients have been at higher risk due to COVID. So what are those conversations like, maybe when the vaccine first came out and the importance about getting it, to your feelings now? And you can be honest. You can be honest. I'm okay with that.
I have great faith in the vaccine. I always ask my patients if they've been vaccinated, and for a long time my patients would ask me what are my thoughts about it, and I would counsel them. There are a group of people left now that are resistant to it, and I think no matter what I say are not going to get it. And in the next breath, I'll give them a new medication for their diabetes, which is much newer, and the technology is less used than the vaccine, and they'll say fine. So I don't quite understand the thought process, but I wish that everyone who's appropriate would get vaccinated and do their part.
Well, I did do an interview with one of your patients a while back, and they said whatever he said, he was resistant, he had not gotten the vaccine, but at the end of the interview, I said, well, what are you going to do? He goes, whatever Dr. Robbins tells me to do is what I'm going to do. I just simply trust him. So let's hope he got it. People do trust you, but I know you're frustrated.
Yeah, it's become a political football, which is unfortunate, and I do my best with my patients, and in the end, I have to respect their decision.
Holly, what about you? What about the pediatrics and the teenage patients that you have?
Yeah, so what we're seeing is a lot of our teenagers actually are interested and have done their research on the vaccine and are actually wanting it. But unfortunately, because of the emergency approval, we have to have parental consent to be able to do that. And so what we're seeing is a lot of parents kind of denying that teenager that vaccine because of their own wishes and stuff. It's been very difficult to hear those teens really wanting it. But unfortunately, we have to respect the parents' consent.
They have to age out of the denial. We're going to go ahead and get to some community questions because they're coming in today. Rebecca wants to know, I'm curious what causes nighttime glucose spikes up to 150 when it's normal during the day. What does that mean? What is 150, Dr. Robbins? Your eyes just got big.
Yeah, well that's probably getting on the edge of abnormal. In nighttime, we would need to know a little more if the patient is taking certain medications and insulin. Typically speaking, glucose levels are highest in the morning. And then as you become more active through the day, glucose levels come down. But I think I would need to know more about that situation to really try to figure that one out. That's not a common question.
So what would you advise her, just to reach out to her physician?
Well, if they can get blood sugars during the day, get a test called a hemoglobin A1C, which measures average blood sugar. Those are things that would help sort out that mystery.
Okay, question from Isaac. He's not a diabetic, but asking on behalf of those who are, and as we hit into the summer months and people getting out and into the water, wondering this: can insulin pumps be safely immersed in the water so that people don't have to miss out on summer fun and summer activity, which you say is so important, Dr. Robbins?
The answer is yes and no. They can get wet, but if you're going swimming or scuba diving, take them off.
Yeah, don't do it. Okay, Kitty wants to know, is the risk of diabetes more prevalent as to the severity of COVID-19 cases? If a child or person only had mild symptoms like sniffles and a light cough, does that play into how severe or how at risk they might be for developing diabetes?
No, it's an interesting question because you can kind of take it to some different ways. But, it kind of all depends on how the presentation of the patient is at first, too. And if we kind of see those early signs early on, then that risk for getting kind of the severeness of it is really low. But if we're kind of focused on other aspects of that health history, then it can go missed and it can be more severe upon the time of finding or diagnosis.
Joellen's curious, any correlation between BMI and diabetes? When I go to my healthcare provider, they give me my BMI score. Can you address that?
Oh, absolutely. The literature is absolutely consistent on this. If you are obese, your risk of diabetes is at least tenfold higher than if you're thin, at least. And what's important that in some populations, what we would consider normal weight is actually obese. People of Asian descent and American Indians, for example, with a BMI of 25 or 27 seem to have the same risk as Caucasians who have a BMI of 30 or 35. So there's some genetic variation in it. But the answer to that question is absolutely.
Kelly is curious, is there any specific foods? Can you dive into the diet other than things that make you obese? Are there any really good foods that help reverse diabetes, keep it away? What can you tell us?
I like the Mediterranean diet,
okay,
which is really a balanced diet with monounsaturated, lots of fruits and vegetables, and using meat as kind of you sort of sprinkle it on top. Interestingly, there's not a real strong correlation between how much sugar you take in diabetes. It's more related to the calories versus how much activity you have. But I love the Mediterranean diet, and the cancer doctors like it, and the arthritis doctors like it. Everybody likes it. It seems to be a common focus of what's been shown as a...
Holly, you kind of shook your head too.
Yeah, I hear a lot of my parents kind of going more towards that Mediterranean diet as well. But kids are growing. That's the thing that you have to keep in mind with children. They're different. They're continuing to develop, so they need their carbs, they need their sugars, they need their simple carbs and things like that, just for their own continued development and things. So kind of restricting their diet is not something we highly recommend in the pediatric world, but definitely, making some adjustments here or there is recommended.
I like this question from Kelly because it probably should be coming from my mouth as well. But when I have young children and I try to keep sugar, and I'm trying to keep their sugar away from them, and Kelly's kind of suggesting that, that her kids could develop diabetes, maybe has said, you're going to develop diabetes if you eat too much sugar. What does that play into it? I think we correlate sugar with getting diabetes. What kind of debunk what that really means?
Yeah, and so your risk of getting diabetes is really family history. So if you have a family history of type 1 or type 2, we have seen, family members that have obesity already, that risk is going to be there. So really focusing on that. But kids are, how I kind of practice with my patients is, if we don't make sugar a bad thing, if we just make it a part of life, it really just becomes something that, I'm not feeling dessert tonight. Or dessert's not on the menu tonight, that's okay, I'm not feeling it tonight anyway. It just kind of makes it a more normal thing. So the more that we can kind of take that stereotype away from sugar being a bad thing, I see that the more parents are having success with kids actually seeing a bigger increase in those fruits and vegetables.
Okay, so my big gasp when I came down and saw my daughter eating a giant bowl of Lucky Charms this morning, and I only got I actually got Lucky Charms as a dessert for them. I said, okay, you guys can have ice cream or Lucky Charms, and now they were eating it for breakfast, and it was like, I'm not getting those ever again for you. So I think a parent, they cringe when Halloween comes around, they cringe when all the Easter candy's there, but you're saying just breathe. Mm-hmm. Don't worry about it. Do you concur?
Yeah, I think
Kind of.
the treatment of diabetes has moved away from rigid diets and rigid insulin doses to flexibility. And I think the old saying that perfection is the enemy of good enough. And if a patient with diabetes wants to have an ice cream cone once in a while and they're wearing a continuous glucose monitor, they can learn how to deal with it and lead a pretty good life. We don't want them going to extremes, but there's enough flexibility with the medication and so on now that we can adjust to those sorts of things. Not a green light, kind of a yellow light.
So not a steady diet of Lucky Charms.
No.
Okay.
It's kind of like a balance. My
is
daughter
about balance.
had a bowl of marshmallows this morning for a snack. So, but she's going to go to school. She's going to have some recess. So we're going to have that.
Okay, so you're going to let it go.
Yeah,
okay.
Going to let it go.
Actually, this makes me feel really good. I have high anxiety about sugar in my house. Okay. Good question. Sandy, what is the risk if you were gestationally diabetic 25 years ago? And I do want to talk about that. I remember having to drink that horrible drink when I was pregnant, and I was so worried. I stayed away from sugar while I was pregnant because I thought, well, am I going to get gestational diabetes for my child? So help us understand all that.
So women that have had gestational diabetes, in the next 5 to 10 years, 50 to 80% of them will become diabetic. So it's a very, very strong risk factor for acquiring type 2 diabetes. What can you do about it? Well, the answer is the same. Stay thin, exercise, eat well, and we can seem to reduce the risk for it. There are some medications that you can speak to your doctor about if you're at risk for it, but it definitely is a risk factor that suggests that you better work hard in keeping yourself healthy after your pregnancy.
Okay, so when I take that drink, what is it testing for, and what is it telling me about me or my child?
So the 50-gram glucose tolerance test that you took will tell you whether or not you are at risk for gestational diabetes. And then
For me getting it, or
yeah,
the baby
and then
getting it.
the baby is at
Baby.
risk for macrosomia, for early delivery, that immaturity, for certain malformations. So it's a very, really a very reliable and potent test to help us intervene early and prevent some of the problems. And women who have gestational diabetes that are treated with diet, certain medications, and closer observations generally have a healthy baby and a healthy pregnancy.
All right, thank you for that. It's been 6 years, I think, since I drank that drink. Never asked what was in it, by the way, but I drank it and it was good. But I always wondered why and exactly what they're trying to find when you drink that. So that's good to know.
Yeah.
Bridget has a question. I don't know if you can answer it, but maybe you have some insight. Can you all speak of extreme altered mental status in the elderly population with Alzheimer when sugar levels run higher?
So I can tell you this. Dementia and Alzheimer's disease is more common among diabetic patients than the general population, and most common in patients who are poorly controlled, that is, their blood sugars are high. So we have a very active research program here at KU in Alzheimer's disease and dementia, and we're seeing that and confirming that here. Having high blood sugars and cognitive issues at the same time has not been well studied. The other end of the coin is when you have very low blood sugars, yes, there's a severe cognitive decline and can be a real problem.
Rebecca wants to know, can you discuss Alzheimer's being called type 3 diabetes? Have you heard of that?
Well, we use the term type 3 for what are other forms of diabetes. There are genetic, strong genetic forms and so on, and I have not heard that term applied to Alzheimer's. Again, one of the major risk factors for diabetes is just age. So every year we get older, we're at higher risk, and people with Alzheimer's probably have lower physical activity. They tend to be older and certainly have a higher risk of diabetes.
Isaac says, I believe type 1 is the one that requires insulin shots and type 2 does not. Probably oversimplifying things, but am I correct?
Sort of.
Sort of. That's a good old-fashioned doctor question. I love it.
Yeah.
Answer.
So type 1 patients usually require insulin, sometimes not right after the diagnosis, but within 6 months to a year. About 80% of patients with type 2 diabetes will eventually be using insulin because the pancreas continues to lose its ability to make insulin over time. So there comes a time where the type 1 and type 2 are fairly indistinguishable.
Okay.
Yeah, in kids, there's not a lot of treatment for type 2. So in adults, we see a lot more availability with regards to different drugs and different injections and pills that are available. But with kids, there's really not that research out there for that treatment for type 2 other than insulin and a couple forms of oral medications.
So what's the earliest age that a child might be diagnosed with type 2 diabetes? Is there a typical age? And is it usually weight related?
It's usually weight related.
Okay.
And I see a lot of my teenagers. I can't say that I've had a lot of young ones under the age of 12 diagnosed with it, but also that's kind of it's kind of difficult to have that conversation with families as well. So we see a lot of resistance to it.
Right. I would imagine. Okay, help Shannon out. Just a couple more questions, but I want to see if we can help her out with this one. I was diagnosed in October of 2020 with type 2. I've always used a CGM monitor and successfully lowered my A1C from 9 to 6.4. Now insurance doesn't want to cover my CGM because I'm not on an insulin or a pump. Any ideas how to appeal to the insurance to cover the CGM? What is a CGM
Well,
for the rest of us?
CGM is continuous glucose monitor.
Okay.
The insurance system and the healthcare system in the United States weights its support to people who get sick rather than prevention. It's irritating because it's much cheaper to prevent a case of kidney failure than it is to treat it. And this kind of thing is very aggravating. Most insurance companies won't pay for continuous glucose monitor unless you're taking 4 shots a day of insulin.
And you think they should cover that?
Yes.
Okay. So here's this person who did this work to lower the A1C, and now they're having that taken away.
Yeah, and they're expensive. It can run $300-400.
So then they're forced to purchase that out of pocket.
Yeah.
if they want to monitor it properly.
I'm on your side.
Okay.
I really
If
am.
it makes you feel any better, probably not though. I've had a kid who it took me 3 months to get him approved for a CGM because the insurance wanted me to prove that they went down into the 40s 3 times before I could actually get that approval through. And to me, as a healthcare, I'm not letting my 5-year-old patient go into the low blood sugars of the 40s where they could possibly have even further complications for proof for you to pay for their continuous glucose monitor. So I concur, it's significantly aggravating with regards to that.
Very frustrating.
We actually like using the CGMs even for a short period of time. So when you get a patient, a type 2 who's new and you're teaching them about the diet, if you put the CGM on for a couple of weeks, they can look at their blood sugars and say, wow, look how high my blood sugar went with a bagel, and they may not, and it's really self-teaching. They begin to learn what they can eat and what they shouldn't eat. And it's really, in my opinion, much more effective than showing them these plastic models of green beans and a baked potato and saying, eat this and don't eat that. So I would love to be able to have that opportunity just to let them, even for a short period of time, to wear it, to learn about the effective diet on their blood sugar.
To actually see it in real time
Absolutely.
happening.
Yeah,
that makes
absolutely.
sense.
Especially in adolescence, I think they're more visual driven,
Yeah.
and so to be able to see like, hey, I went to McDonald's, oh, whoa,
And this is what's happening in my
happens.
body.
I think that would really have a positive impact.
Absolutely. Okay, Angela, what about the correlation between the heart and diabetes?
So people with diabetes are 3 to 5 times more likely to die of heart disease than people who have the same blood pressure, the same cholesterol, and so on. So diabetes is an independent risk factor for heart disease. And I can actually consider much of what I do as preventive cardiology. So I'm trying to prevent the heart attack by keeping the blood pressure low, keeping the cholesterol under control, and the glucose under control, and getting them to exercise. So the answer is there is a higher risk, but the good side is that given everything we can do, we can lower that risk considerably.
Okay, another question is, and Holly, just maybe you could talk about it when it comes to kids, because back to that question I was concerned about with the sugar. So is sugar something we worry about after you've been diagnosed, not as much before you've been diagnosed?
I think it's something that we should always think about, especially with today's society and the increase, numbers of childhood obesity and obesity in general. And then now with the pandemic, and we're seeing kind of that decrease of activity and that need to, that going out and doing our typical, routines or athletic events, things that we're used to doing and now we're not. And so I think we just need to be aware of it. But I think kind of being aware of our rhetoric and how we're kind of approaching it in front of our young ones, I think is the important thing.
All right, we are going to get to some final thoughts here in just a few moments. Just want to update you on something, that it is Severe Weather Preparedness Week across the Kansas and Missouri area. So now is the time for you and your family to make plans on where to go in severe weather, or if a tornado were to strike nearby. And start getting your emergency supply kits ready. Those should include your medications, non-perishable food items, and of course batteries and flashlights. We here at the health system will be taking part in a statewide tornado drill starting at 10 a.m. today. The drill is for all locations in both Kansas and Missouri. If you're coming here to the hospital, you'll hear those overhead announcements and alarms. At other locations, you will hear sirens and weather radio alerts, and those will be activated. Andy Marshall is the Emergency Preparedness Manager here at the health system. This is his advice.
During this week, not only is Kansas State Emergency Management really testing their tornado sirens, their NOAA weather radio alerts, it's allowing us to review, look at our policies, and make sure that we are all prepared and ready.
Even with COVID restrictions easing in many places, health experts advise you to stay 6 feet apart and wear a mask. If that's not possible, then simply shelter in place, or discussing where you'd go and what you do in either of those options. So just be ready and prepared. And we're going to talk more about this on a later episode of the Morning Medical Update. Okay, so I want to get to some final thoughts from our guests. This has been a really good conversation. I think the questions could go on and on all morning, so we'll have to have you both back. Holly, just some final thoughts. Anything that I didn't ask you that you want to make sure that people know about? Anything a message for parents, pediatric patients?
I think right now my main message would be the mental health piece. I think patients are really struggling with isolation, especially in those adolescent years. So having that open communication with your child and your child's pediatrician. We have a great group of pediatricians here at the University of Kansas Health Systems and a great group of behavioral pediatrics here as well with the psychiatrist who are very open and willing to kind of help you navigate through those times, even if your child doesn't have a chronic disease like type 1, but utilize us as providers and we have those resources and things available for you. So I really think that that's kind of the big thing right now, is making sure the mental health is taken care of.
That seems like it almost should be number one. So important. Thank you for bringing that up. Dr. Robbins?
If you have diabetes, I would encourage you to be an informed and assertive patient. Mm-hmm. There are goals of getting your A1C down below 7, your blood pressure close to 130, getting your cholesterol down. Don't be afraid of challenging your doctor and saying, why are you letting my blood sugar stay with an A1C of 8%? What can I do? That should be a constructive partnership, and I think people with diabetes should speak up and not be afraid to ask for quality care and really get the best they can to maintain their health from their doctor, and also to do their part in terms of lifestyle changes.
Absolutely. Be your own health advocate.
You
that
bet.
goes towards the insurance companies too. So for that one viewer's question, definitely be an advocate for your insurance company and keep pushing.
Keep pushing.
Absolutely.
Love it. Really quick question though. Rebecca wants to know, is there a brand of CGM over another that you like? Freestyle seems off a lot. I don't know if that means. And then Dexcom, is that better?
Dexcom, yeah, they're both good. They
Okay.
have a few subtle differences.
Okay.
The Dexcom we like to use with the pumps because it communicates, but they're both good. I would not recommend one over the other.
Okay, great advice. Dr. Hawkinson,
Yeah.
how are you over there?
I'm
Final
good. I went
thoughts?
for some coffee.
That's what I was
should
gonna
have
say.
offered to get you guys
You
some.
could take a nap, go on a coffee break, go see patients, and now you're back.
That's
Okay.
right. Yeah. It was a good show.
I think
think
so.
this plays into overall health, and we are trying to promote that. Go to see your physicians and your medical teams. Get those screenings done. Screenings for diabetes are very, very simple, but as we know and we've heard, if you step in and intervene early, you can help prevent some of those complications down the line. So that's very important. Continue to work with your medical team, see your physicians. Obviously, we know cases are going down. We know our clinics are safe. Come here, get to those visits, do those preventive things, vaccines, especially COVID vaccines, and get up to date on your other regular vaccines as well. So I think this was a good show, and just goes to show you that there are other things, and that if we want to continue to protect ourselves and be in that preventive state of mind, we can do that, and down the road that will all benefit us.
Yeah, great point.
Yeah.
All right, March 30th is National Doctors Day, and here's a way to say thank you to all healthcare providers. We know a lot of you in the community want to show your gratitude, so right there on your screen is a QR code so that you can do just that. So once you click on that code there, it takes you to your email. It's so simple. There's an email address where you can send the video to us. So we ask you to put in your name and hometown so that we can give a little shout out to you. Just note that the videos cannot be any longer than 25 megabytes, which is about 30 seconds. So keep them kind of short and tight. Then you can send them in to us. And then, of course, we are going to send them on air. Yes, Logan, nice to see you there. Okay. How'd you sneak in on this show like that? I love that. Okay. So again, send a thank you to a healthcare worker by simply just clicking on that code. Takes you to the email. Make a video, send it to us. So you'll see yourself on the Morning Medical Update. So we can't wait to see you, and thank you so much for being with us today. Don't forget, you can catch our shows anytime by logging onto Facebook, YouTube, and now on Twitter. COVID has impacted every part of the healthcare field, including organ transplants. So tomorrow, we'll talk about the changes that are in effect. If you are awaiting a transplant, there are a lot of questions about this. Like, can someone who has had or has COVID donate an organ? We'll get the answers to your questions tomorrow on Open Mics with Dr. Stites. Have a great day. We'll see you at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.